Take a few seconds to close your eyes and think about what the word research means to you. Chances are you probably envisioned labs with state of the art technology being run by genius scientists with multiple degrees. This is the impression that the modern media often gives us of research. And more often than not, we're led to believe that research can only be done within the confines of this narrow narrative. But if you've had any experience at all with research in the past, you'll know that this is not true by any means. Research is accessible to everyone. In fact, you could start right now at home with just a laptop and internet connection. There are countless avenues towards research, but today I want to talk about one way that research becomes bigger than itself and can have a significant social impact, especially when it comes to rare and uncommon diseases. Individually, most rare and uncommon diseases affect only a few hundred to several thousand people, but collectively, rare diseases affect more than 25 million Americans. Sadly, many of these diseases are life threatening, and about half of all patients affected are children. Because rare diseases affect such a small percentage of the normal population, they can be extremely challenging to study. Scientists often lack basic information about a rare disease's symptoms, its biology, and the ways it can affect people over time. To top it all off, research funding can be scarce. Of the estimated 7,000 known rare diseases, only a fraction, maybe 5%, have FDA approved treatments. To increase that percentage, the National Institutes of Health awarded approximately $31 million in grants to scientists, clinicians, patients, families, and patient advocates in 2019, dedicated entirely to the study of a wide range of rare diseases. And while the funding is certainly a catalyst for scientific progress, the ability of this research to generate a societal impact by organically raising awareness for the disease of study is one of the most important aspects of this entire initiative. How do I know this? Well, my own journey revolves around studying and researching rare diseases through personal experience. When I was 4 years old, I was diagnosed with sudden bilateral hearing loss, with severe loss in my left ear and moderate loss in my right. This was a shocking diagnosis because I was not born with any form of hearing loss, and no one in my immediate family had ever been diagnosed with any form of juvenile hearing loss. Seeking answers, my parents and I traveled from specialist to specialist, sometimes traveling 3 hours one way for an appointment. And every single time we were met with the same answer: idiopathic. Basically, nobody had any idea what could have caused my condition. Growing up with hearing loss was not easy. In elementary school, many of my peers just had no conception of what it meant to have this condition. I was the only person with hearing loss in my school, and in the US, only 0.133% of children born have permanent bilateral hearing loss. So when I would wear my hearing aid, my classmates saw me as an anomaly, and for the most part, just ignored me. And got to the point where I just stopped wearing my hearing aid entirely in order to avoid the social repercussions. I moved to a new school, and I just wanted to be normal. I would routinely sit in the front of the class, and I quickly picked up lip reading in order to fill in the gaps of what I couldn't hear. I viewed my condition as a weakness, and I thought denial was the only way I would be able to survive. For the most part, this strategy worked out pretty well all the way up until the end of middle school. However, it didn't do anything at all to address the underlying problem, which was the stigma surrounding hearing loss because of a lack of awareness in K through 12 schools. On top of that, I shortchanged myself when it came to developing social skills and building relationships with the people around me. In just the first few weeks of high school, I had multiple botched social interactions resulting from my inability to hear what somebody said. I was forcing myself to be accountable for that which was physically impossible for me, and I quickly realized that this charade couldn't continue any longer. I knew I wanted to do something to break the stigma and create more awareness, but I didn't know how or where to start. And then, in the winter of my freshman year of high school, I came across a video that really changed my entire perspective. This video shared the story of Dr. Matthew Might, a computer science professor at the University of Alabama, Birmingham, and his quest to save his son Bertrand's life. Bertrand was born with severe cognitive and physical deficiencies that baffled doctors for years. For over 4 years, specialist after specialist in the United States tried every conceivable diagnostic test on Bertrand, all with no luck. And at the same time, Bertrand was getting worse, so bad in fact that doctors feared that he wouldn't live much longer. Having done everything possible, Dr. Might turned to the impossible: science. With a team of researchers from Duke University, Dr. Might sequenced his genome, his wife's genome, and Bertrand's genome with the goal of looking for mutations. And sure enough, they found a complete knockout of the NGLY1 gene. With that discovery, however, came solemn news. Bertrand was the first ever patient with the new disease NGLY1 deficiency. He was patient zero, all alone, with no community, no prognosis, and of course, no treatment. Doctors said it would take decades before even a second patient with such a rare disease could be found. But Bertrand didn't have decades, and although he didn't have much biology experience, Dr. Might was determined to do whatever he could to bring a cure closer to reality. He collaborated with scientists from all over the globe and harnessed his computer science expertise to repurpose existing FDA-approved drugs in order to treat Bertrand's symptoms. Throughout this journey, Dr. Might ended up accomplishing more than just figuring out medicinal treatments for the symptoms of a new disease. He was able to build a community. At his conference talks and through his blog, Dr. Might constantly met new people that were going through exactly the same thing that his and his wife went through. Dr. Might and his wife built a community of over 70 NGLY1 deficient patients, progressing its treatability farther than ever imagined before. For me, this was a huge wake-up call. I realized that if Dr. Might was able to do this for a completely new disease, then there's no reason why I can't do the same for hearing loss. So I reached out to local universities asking about research opportunities, and I was lucky enough to get connected with a drug discovery lab. After 8 months of intense training, I worked on a 10-month-long drug discovery project targeting a key protein that had been previously linked to hearing loss in mice. Throughout my research, I witnessed my own version of Dr. Might's journey emerge. It was a long and tumultuous ride with numerous ups and downs, but it was entirely worth it in the end. Research empowered me to share my findings in my local community, at science fairs, and in the wider scientific community as a whole. But beyond that, it gave me the confidence to address the stigma surrounding hearing loss, and I became comfortable with wearing my hearing aid again. I willingly embraced every stare and question. Sharing my experiences gave me the confidence to publish my first Udemy course, geared towards providing the general public with the tools to conduct research on a deeply personal topic. To be able to build a community of people passionate about researching a deeply personal cause, and to empower them with the tools and resources to make a difference in their own communities, that is the most rewarding part of this entire journey for me. On its own, research-based communication in a scientific manner was able to help Dr. Might build the community of NGLY1 deficiency patients. It helped me to spread awareness of sudden bilateral hearing loss in my immediate community. It helped Rare Diseases Europe to establish an international annual Rare Disease Day. It helped the FDA build dedicated resources to developing cures for rare diseases. The list just goes on and on and on. At the beginning of this talk, I asked you all to note what you think of when you hear the word research. Most likely, none of this crossed your mind in those first few seconds. The potential of this research, however, to have this kind of social impact may seem uncharacteristic, but really, it is the driving force behind discovery and innovation in today's age, whether it's applied to rare diseases or elsewhere. If there's one thing you can take away from my talk today, never be intimidated. If you have a cause that you're passionate about, then do everything you can to achieve your goal. And if you're at a loss for where to start or where to begin, embrace research. It will go a long, long way. Thank you.